Hi, I'm Dr. Mark Wheaton of Lakeside Sports and Pain Clinic in Excelsior, Minnesota, and here in Monaga, Minnesota. Today we're going to answer some questions that people have about pain and the treatment of prolotherapy. So the first question I would like to answer is, what is the most common cause of chronic pain? So the most common cause of chronic pain is by far and away damage or injury to ligaments and tendons around joint tissue. So when we talk about joints, we talk about hips, knees, ankles, shoulders, elbows, wrists, and not forgetting the spine. People with chronic neck pain, middle back pain, low back pain, all suffer from ligament problems, and ligaments are structures that hold joints together. So think of it as taut rubber bands, and for example, if a person has a knee problem, the only reason their knee is able to function normally is because the ligaments act as check reins, or just like strong rubber bands that hold the joint together, that then allow your muscles and tendons to move that joint. So what are ligaments and tendons? Ligaments, as I said earlier, are made up of connective tissues called collagen. And collagen is the most abundant protein in the body with the connective tissue, and it forms the basis for the strength and resistance to stretch in joint tissue. Secondarily, tendons are structures that connect muscles to bone, and as we know, muscles are what you see when you exercise, and those structures, when they contract, will pull a bone toward or away from your body. So ligaments hold bones to bones, and tendons attach muscles to bones. Next question is asked, what is prolotherapy? Because oftentimes we're going to say, okay, so I have ligament problems, so I'm loose jointed, or I've injured my ligaments and I have joint pain. What can I do about it? So the treatment of prolotherapy is the only real effective and long-term treatment for ligament injury to joints. So prolotherapy is an injection method which uses natural solutions to stimulate repair of the injured tissue. So think of it this way: whereas you go to the gym to exercise muscles, unfortunately you can't do that with ligaments. Ligaments are not able to be strengthened by use. The only way that they can be strengthened is by induced proliferation. Now that's just a fancy term for stimulation of growth. So the term prolotherapy really is a treatment that takes your body's natural tendency to want to heal, and it jump starts the process. So when I give injections of a simple solution such as dextrose, which is a type of sugar, that's all it takes to just get the process moving forward, and then the body reacts to it like it's an irritant, and it will then proceed through 3 stages of healing. The first stage, when the injections are made, is called the inflammatory stage. So a small amount of inflammation is created, a very controlled amount, at the sites of injection. And interestingly, most people will think, well, that's not good, is it, to have inflammation? Well, in this case, it is good, because inflammation is the first stage of healing. That's the way your body naturally heals, but oftentimes we interfere with it by taking anti-inflammatory drugs or doing cortisone shots, and I'll talk about that in just a minute. So after the first stage of inflammation, that lasts 2 or 3 days, then that leads into, or triggers or jump starts, the process of proliferation. I call it the fibroblastic stage, because these little cells cause the development and growth of collagen fibers. Now, collagen fibers are just elongated strands of fibrous tissue that make up your ligaments. But when you're injured, or if you're born with loose joints, they tend to get stretched and don't repair very well on their own. So the process of prolotherapy helps regrow those, and over a period of several weeks, a development of new collagen, and thereby stronger ligaments will occur. So after that stage, which lasts about 4 to 6 weeks, Final stage is the maturation phase, and the maturation phase is simply an elongated phase of number of months or even over a year where the tissues just mature and get stronger and stronger. This is why we can all get interested in getting prolotherapy, because it is a long-term solution to a problem, and we don't want to ever give a treatment that we would want to just say, well, this will just help you for a month. This is a treatment that can last pretty much indefinitely with the right number of treatments. So I've given a brief description of how prolotherapy works. Next episode, we're going to talk a little bit more about some of the things that prolotherapy treats and why you should not subject yourself to cortisone shots, which ultimately can lead to unnecessary surgeries. If you have any questions or want to know more about prolotherapy or whether you'd be a candidate for the treatment, please don't hesitate to call us at 952-593-0500 or go online at drmarkwheaton.com. Thanks for joining me today.
Thank you for watching Wellness for Life.